As you saw in our last installation procedure, we have already installed the software and I have taken out a shortcut on the desktop. As you can see here, I start the software. You can select this accounting year, you can select username, password is SS, and then we go in. Now as we go to the patient information, let's have a look at what all information we can fill in about the patient. This is a registration page where you can add a new patient. Once all the information is added, you can save the patient. Registration number, OPD number and IPD number are automatically generated by the system. However, they can be manually input as well. You can disable auto generation of these numbers as well in the configuration options. You can enter the referring doctor's name here. You can click on this and select the list, for example like this. You can also select who is the doctor looking after that patient in the hospital. You can give telephonic appointments to the patients who call on the phone and ask for it. You can find any patient with this find patient facility. For example, you can find it by some part of the name, or you can find it by name of the city. Then you can say search patient by IPD number, OPD number or registration number if you know them. Today's patients will actually give you a quick list of all the patients who have visited today, and you can as well search a patient by the telephone number if you have entered the telephone number. So these are various options with which you can find a patient, and almost every patient can be found with one of the piece of this information. Okay, so this is the registration page. Then there is clinical information page where you enter complaints, history, examination, procedures, provisional and final diagnosis, and advice and follow-up. All these are basically the parts of the case paper which accumulate into a case paper finally. There are three ways you can enter medical information. You can use either the clicking formats, or you can use the text formats. For example, there can be a standard text paragraph for a normal fever kind of a case. You may directly import it into the examination section, a predefined format, so you don't have to click anything or you don't have to type anything. You may want to, after importing, change something in it, so you have to click on this button, which is view and edit case paper details. So all these three options of data entry of clinical records together, they make clinical entry really easy, and you can exactly choose the way you want to use for a particular patient. Then we have clinical documents. For example, here we have a medicine prescription where you can select the diagnosis. Let's say this is the diagnosis, the group, and then probably the medicine, then another group, and medicine, and so on. This can print it in three different ways. One is that you can insert a line between the medicines. This is more to do with the look of the prescription. You can decide whether to include this or not. Then if women are there, you can click this. If the medicines you're prescribing are having any type of concern with their pregnancy. You can also specify the next appointment here for the patient, and then you can print it in English, Marathi, Hindi, Gujarati, Bangla, and so on. All these buttons are disabled in this particular installation because it's a demonstration or evaluation copy. So this is the medicine prescriptions. So as soon as you enter those medicines, you would basically see them entered in the case paper in the procedures and treatment part of it. Now let's also enter some complaints. So I am going to use the clicking form. So let's say that patient has edema in respiratory tract. Let's say he has a cough and probably this. In ENT, let's say he has a fever, and so on. I can either return back to the clinical entry page, or I can go to the family history for entering the family history. Here I can replace earlier findings or append to earlier findings. So for example, if I had filled in complaints for this patient in the morning and now I'm visiting in the afternoon, then I would like to append these findings to the morning findings. So in that case I'll use append. But if this is the first time probably, or if I want to replace morning findings with what I'm clicking now, you may say replace. So I'm going to say replace for now. Then I'm on to history details because I clicked to family history button there. So I say similar illness was there in mother. Then in past, let's say there is major illness, that patient has TB, ISD, history of trauma, yes. And probably on personal front I would say he's a smoker, he's a drinker, and he probably has a normal sleep but has a urinary problem, and so on. Now again I can return back to the clinical page or go to the examination findings. So I have completed the history findings, and I'll proceed to examination findings entry. These are examination findings. So let's say he has a pillar, then this in respiratory tract, whatever, in per abdomen, let's say this is tenderness is there, then this in ENT, and so on. And then I say done. So I have entered complaints, history, and examination. Now what I would like to stress here is that this form which we have provided here is according to our medical panel doctors. They have suggested that this can be standard symptoms that we can provide in the software, but you can erase all this or modify this. If you want to create your own paper, you can completely create a new paper here with the exact symptoms that you would like to practice, and then that makes your life really easy. You don't have to really search for a clicking symptom on multiple pages. You know exactly where you have defined it and just go there and click it. It makes it very easy. So I would say done, replace. Now if you see, these buttons have turned pink. This means that this part of the case paper contains something. So if I go to complaints, I would see that this is what we had clicked. In addition, I want to add something. This is a test symptom, let's say, and then I can save this. So I have modified what I entered using clicking formats. Similarly for history, examination, and so on. Let's also define then the diagnosis. Let's say he has appendicitis, and then I would say final diagnosis also appendicitis, and save it. So you can say that provisional and final diagnosis options have also gone pink. On advice and follow-up, I may like to give advice: take regular exercise. There are more than this way of giving advices. You can actually create word templates and just print them with all patient information like name and admit date and visit date merged into it. We'll see it later. Okay, now we have entered almost all the information in the case paper and we are ready to see the case paper. So let's see that. This is okay. I would straight away go to regular case paper. So this is the case paper which is generated. So cardiovascular, these are the complaints which we entered. This is the history which we entered. This is the clinical findings. And if I go to next page, then advice and follow-up and treatment and so on. What is interesting is that this has date-wise entries. So if I make it on 11th of September, I'll have another entry and so on. So complete history of the patient is maintained automatically. I also have a choice to see what was the case paper of this patient on 2nd. In that case, I would say date-wise case paper. So on 2nd, I had probably entered only final diagnosis and complaints. Sorry, on 10th I have entered it, not on 2nd, and so on. Okay, I can also individually see parts. So if I want to see all the examination findings, I would click on this and then see all the details there, right? If I click on this date wise and again see the case paper of 2nd, I would see nothing entered there. But if I want to see the case paper of 10th, this has to be clicked, remember, and then I see only 10th. So you can actually see of any date's case paper separately also, as well as the total admission case paper together. Discharge card can also be generated from this, and so on. You can also maintain some information about allergy, what medicines the patient is allergic to in this particular form. You can have a blank discharge card where you can enter all the information. If you don't want the case paper to be copied as a discharge card, you have a facility here where you can actually type in the history, whatever you want to mention in the discharge card, and so on. Okay, this is most of the clinical part. I can also prescribe investigations to the patient. So I can say, for example, dear Dr. XYZ, referring so and so for investigation. She has acute appendicitis. Please get the following investigations done. So I say abdomen USG. If I want to write some notes, I can write here for the doctor's information, and then I say yours sincerely, and then I can print this note. So for example, if I preview this, this is how it is printed, and save current note. You have actually a facility whereby you can see all the notes which have been given to this patient one after the other. So you will always have all the record about the patient and your transactions with the patient. You also have note to referring doctor, where you can say that dear doctor so and so, my impression is acute appendicitis. If I want this sentence to be included, I can click this, and then you can say I will keep in touch, thanking you, so and so forth. And then if you see this, this is how the note will print, and you can in fact after usage improvise this to suit exactly how you would like to send it back to the referring doctor, and you can save this as well. Then we have a hospitalization note. In case you feel that patient needs to be hospitalized to a bigger hospital for a serious surgery, then you can probably write to CMO of that hospital and admit that patient there. You have a medical certificate. These are all possible options which you can click and select and configure the medical certificate. You also have a referral note. So if you are referring the patient to somebody else for further investigations or further examination, then you may use this. So these are basically all the clinical forms and information. There is, however, one more feature of analysis. This feature basically enables you to analyze all the data that you have put in the software for years probably. So for example, if I do analysis, I would say that one vessel, this is probably a sample analytical paper. Let's say 2 vessels, whatever. D1, this is a cardiologist's analysis parameters. So I say this, then post-operative, whatever the complications are, so, and save data. If you see, these are the analytical parameters that we have specified for this patient. Now there is a facility where you can actually go to reports analysis, and you can see count-wise analysis completely, which gives you all the information as to how many patients of a particular type came, how many patients of a particular parameter came, and so on. You can also completely customize this analysis entry form according to the parameters that you would like to analyze the data on. So this is also a very useful feature. Then documentation, as I said, this is for example, you can create a lot of templates. I have now created a discharge summary template, and I'm going to use it for the patient to create a document. So let's see how it looks. Reports. So let's say discharge summary, or let's say discharge summary. Yes. Now this uses Microsoft Word for reporting, and then you would probably see all the details that a discharge summary should contain. So for example, blood group and all this. So these kind of formats you can prepare in the Word library, and you can use. And as you can understand, there is no limit to how many formats you can create. So you can almost templatize each and every document in your hospital and then use it for the patient. And this is always saved with the patient for entire lifetime of the software. Okay, let's go to doctor charges. Now we go into the billing portion. This is how basically you enter the consultant charges. Then these are all the consultants who visit that patient during indoor admission, or this can be a simple consultancy fee. In services, again, you can enter all kind of different services that have been offered to the patient during his admission or the OPD visit. Then you can also associate a stock with the patient. For example, if you have used disposable syringes, bandages, or some costly items for the patient during operation, you could specify them here and they would be charged in the bill automatically. We also have an option where we say that patient has received or patient has returned some of the material back. So I enter it here. So something which is not returned by the patient will only be charged to the bill in that case. In investigations, you can specify which investigations have been carried out for the patient if you have a diagnostic center. And in operations, of course, I can say that the patient underwent forceps. Of course, this is a sample operation data, 5,000, and I can save this. And I can also have then operation notes. For example, on this day, let's say indoor. Now these are again the operation details. So I can say that when we performed the operation, that patient was given general anesthesia, anesthetist was Dr. Patil, indication was primary infertility, and so on. So what was CX quarter and what was the treatment, obstetric operation, so and so on. Again, you can completely redesign this according to what you want to store as operations information. So I'm going to save this, and I'm going to associate it, all the information entered with the operation forceps, which I have already registered for the patient, and then I save this. So this is the entry of the operations. Then I can associate a bed. So for example, the patient was admitted in general ward, let's say on 1st of 9, and I save this. And then when I discharge the patient, let's say the patient was discharged on 7th 2010 12 p.m. and save this. It will update the bed moments, yes. So if I go back to beds, I would see that the patient is discharged and number of days that will be charged to the patient are 6. Now this will come into the bill automatically. Okay, now I go to the bill page. Now as you remember, we have entered these bed charges and operation charges during this entry cycle, data entry cycle, but the patient bill was already prepared in the earlier data entry cycle. So what it is telling us now is that these are pending bed charges and pending operation charges. They are not yet considered into the bill. So as you can see, the bill was 4950, out of which I have received 1000 rupees, and I have balance of around 3950 rupees. Now what I'm going to do is I'm going to revise this bill to accumulate all these pending charges. So if you see, the bill amount has been accumulated. I save this now, and then I can say that I have received the amount of 9450 from the patient now. So I'm going to book this receipt. So cash, and I save this. Do you want to print the receipt? I would say no for now. You can print it as well. You can also set the receipt on the stationery size and format do you want to use. So all those documents are customizable. So as you can see, the complete amount is received and we have a zero balance. So let's quickly look at other options available here. We can also have some insurance information stored with the patient. So for example, this, out of this amount, let's say 3950 was the insurance due, or let's say after adding the new charges it has gone to around 7800 or 8000, let's say. So all this will be recalculated. These are all the service taxes and education cess and so, which is mandatory for the insurance. Save, and now I can see the insurance bill. So this is the invoice format, which is printed in a standard insurance advised format, and then this is the total amount payable from the insurance. So this also supports insurance bill generation. You can also see the indoor bill. So this is quickly a view of the indoor bill. These are the charges that we entered, and then I can also see a detailed bill where I would get a breakup of each and every charge that I have entered to the patient. So the difference between this and the indoor bill is that if I have entered multiple beds, then I would say multiple bill entries in detailed bill, whereas I would say only one entry called bed charges, where all the bed charges are accumulated together. So that is how that happens. I can also see all the transactions that have happened with this patient. So no, okay. So just to quickly summarize, we register a patient here with add new. We save the patient with all the relevant information here. Then probably a billing section may not go to clinical and documentation page. They would directly go to doctor charges, enter the doctor charges, service charges, all the stock transactions for the patient, all the investigations done for the patient, operations done for the patients, bed allotments for the patient, and then generate the bill. So this is basically 4, 5, 6, 7, 8, 9 and 0. Along with 1 are the billing related pages, whereas a doctor normally would use clinical page to the maximum, and then I can use documentation page, so anybody can use this. One of the facility which is important in any software is restriction of data access. I'll quickly show you that. What you can do is you can create multiple levels of users. You can define a user as either an admin user or a billing user or a cashier user or nurse or something. So you can define 10 levels, and you can actually secure data. These are all the menu options that you see there, and these are all patient form facilities. So for example, if I don't want the user who is a billing user to see clinical details, I would just click on this, and for a user who is of billing type, clinical page would be disabled. I would also like to block delete bill for everyone else than billing, so I can just click this. Okay, so as you can see here now, only a billing section person would be able to delete a bill, nobody else would be able to. So this is how you can actually secure who can do what in this software. Okay, so that was basically the demonstration of how you enter patient information and how you enter all the clinical as well as billing information. Then just a quick view, you have all the master data set up here, which is used while entering the information of the patient. You can define the medicines and stock here. You can define referring doctors details as well as consultant information. It also has comprehensive financial accounting, so if you plan to use it, you can define accounts groups and account heads here. Then you can define the library here. So if I see the document or scan report, so let's say I want to modify and see how I have defined it. So I can do this, and I can probably modify it like this: patient name, and then I can go to insert merge field and enter a pat name. Then I can say referred by. I can go here and insert referring doctor's name. Can we see it? Referred by, yeah. You can also say consultant, and then who is looking after the patient, so you have consultant, and so on. If you see, you have most of the patient information here, which can be used as a mail merge variable in your document wherever you want. And then when you generate, now this is, for example, this is a template that we are generating, so I save this template, close it, and then let's close this document library and generate it for the patient. So if I go to patient, document, and I say create new document, reports, scan report, this is the one which we modified. So you would see that this is the information which we entered. Now we have not selected referred by and consultant for the patients in the patient registration form, so it has not come, otherwise it would come. So let's quickly try that. So I say that referring doctor is Dr. Mehta and the consultant is Dr. Mehta again, or let's change it, Dr. Moite. Save this, go there, say create a new document, reports, scan report. It would say that it was already prepared, select no to create, so I would say no, and I create a new document where all this information is now properly available. You can define any number of templates like this, and that is what gives you a power to use this software to the fullest. Well, there is a lot in the reports. You can see various reports: bill registers, receipt registers, charity registers, IPD, OPD registers, and so on. You can also read referring doctor wise registers and bill to hospital. For example, if you are going to a hospital for doing surgeries and send a bill at the end of the month to the hospital for cumulative payment, you can use this facility. You can also have the analysis reports, you can have stock reports, and you can have accounting reports. You have various utilities whereby you can actually configure. If you remember, we had used examination format, and I had said that we can customize it. So you can, this is the way it is, and you can go on adding your own symptoms here. You can provide clicking options for the symptoms here, and so on. Well, it is enough for now. So thank you very much for your time, and I wish you all the best with Visual Hospital Manager. Thank you.